This is one of the more vulnerable parts of this story. I felt the most shame at this point in time, at this moment with this person. When I told the gynecologist that got assigned to me what this person said and did, he was in shock during my second appointment that I showed up in person because my first one was a video chat. He was in shock. He said, I didn't think you were going to show up to your appointment, honestly. And we're laughing because we're getting along really well. And I said, why? Why would you think that? What did I do to make you think that I wouldn't show up? And he said, you didn't do anything. It's what we did to you. I really didn't think you'd come in after how you were treated. So I feel better knowing that even the gynecologist thinks what this person did specifically was just beyond why. So at this point, it's probably about 6:30 in the morning, almost 7. And I know this because I use my chart, and it tells me that when I got seen by the first doctor and they started doing the first test, it was about 6:37 in the morning. So it's been about 7 hours. But before the doctor, I had to get changed into a gown. And that's when I met Miss See You Next Tuesday. I don't think she was a nurse, and I want to say now the nurses were wonderful. I have nothing against nurses. When I got upstairs and had to spend a few days in the hospital, I don't think I would have gotten through it without talking to some of the nurses that I did. They were vulnerable. They shared their own stories. They told me how this wasn't my fault. And I honestly don't think I would have made it through the first 2 nights without them. So this has nothing to do with the nurses. This woman was not a nurse. I get brought to a gurney in a hallway because obviously it's an ER, it's busy, they don't have rooms. And when I get wheeled in, she tells me to get up and she wants me to change into the gown and get into the gurney. I immediately tell her through gritted teeth, because I'm still having contractions and screaming, I can't. She immediately says, well, you got yourself to the hospital, so you can get into the bed. I don't have a big backbone. It's just something that's known about me, especially if you've known me in this channel. I don't fight for myself very often. And that is something I'm trying to work on. But at this moment, I was in too much pain to even try to fight back. I just was crying. If I wasn't screaming, I was crying. I was terrified. I was alone. I didn't know what was happening, and I felt like I was dying. I remember looking at her and begging her, ma'am, I can't. I can't. And I was standing up at the same time, and I was wearing this pair of leggings that I've had for a long time, and I do miss them because I did have to throw them out because at this point they were a biohazard. Everything was soaked. The wheelchair seat below me was covered in urine and the infection fluid, and there was nothing I could do about it. My leggings were soaked to the bone. I was dripping on the floor. She was visibly and audibly disgusted. She holds the gown in front of me, like away from her, and goes, oh, girl. She tells me verbatim, you can't be coming into the ER smelling like this. We are ladies. We have to do better than this. You have to take better care of yourself than this. I don't even remember having a reaction to her. I just cried. She points me to the bathroom on the other side of the hallway and tells me to go in there and clean myself up. And I'm telling her I need help, and she tells me that she can't. I need to take care of myself. So I go into the bathroom, and I remember just grabbing onto the sink and just bawling. I wasn't having a contraction at that moment, and my legs were shaking. I'm crouched over, can't stand up straight, obviously, at this point. And I didn't know how to clean myself up because I don't even remember thinking like a normal human at this point right now. I did my best, and I did my best to put that gown on, but I couldn't even clean my clothes up off the floor, and I could tell she was upset about that too. I got this question on Facebook, and it was a really good one. When I got put onto the bed finally, and I was laying there, I finally met the first doctor. He comes out and he talks to me for a minute, and he hears that I have abdominal pain. Finally, someone with some sense. He's the first one to jump to an ultrasound and a pelvic exam. I remember these things happening. I remember trying to explain what was going on with me for the last 48 hours. And that's when I heard them kind of whispering to each other, no, there's a full-grown baby right there. And then it was like the panic lights went off. I was brought into the CCU next door because they told me there was no time to bring me up to labor and delivery. At that point, it was too critical of a situation. So now I'm terrified, alone, and shamed, and about to give birth to a baby I didn't know I was pregnant with.